Welcome to BetterHealth Pharmacy, * on this channel. We share trusted advice and practical tips to help you stay healthy every single day. * from understanding your medicines to making smarter lifestyle choices. We've got you covered, * because here at BetterHealth, we're caring for your health, one video at a time. Let's begin.
The topic of today is diabetes mellitus. A 58-year-old man with long-standing type 2 diabetes presents to the pharmacy with a painful wound on his foot. On examination, there is a non-healing ulcer with signs of infection. He admits poor medication, adherence, and irregular foot care. This is more than just a wound. It is a diabetic foot ulcer, a serious complication that, if left untreated, can lead to amputation. What is diabetes mellitus? Diabetes mellitus is a chronic metabolic disorder characterized by elevated blood glucose levels or hyperglycemia, which results from abnormalities in either insulin secretion or insulin action. Blood glucose is regulated by the pancreas, which secretes the hormones insulin from beta cells and glucagon from alpha cells. Insulin lowers blood glucose by allowing it into cells for energy or storage, while glucagon raises blood glucose by stimulating its release from the liver when levels are low. It also manifests as carbohydrate, fat, and protein metabolic dysfunctions. The structural and functional disruptions in organ system vasculature lead to micro and macrovascular complications. Organ damage, dysfunction, and ultimately, organ failure characterize these complications and affect body organs, which include, in particular, eyes, kidneys, heart, and nerves. Eye-related complications result in retinopathy, with progression to blindness. Kidney-associated complications lead to nephropathy and potential renal failure. Heart-related complications include hypertension and coronary heart disease. There are different types, and for you to know what type it is, you need a proper diagnosis. Type 1 is an autoimmune disorder characterized by T-cell-mediated destruction of pancreatic V cells, which results in insulin deficiency and ultimately hyperglycemia. In other words, your immune system attacks these cells that secrete insulin. Type 2 is characterized by insulin resistance and V cell dysfunction. Insulin resistance results from disruption of various cellular pathways, which lead to a decreased response or sensitivity of cells in the peripheral tissues, in particular the muscle, liver, and adipose tissue toward insulin. Gestational type is any degree of glucose intolerance or diabetes diagnosed during pregnancy, usually the second or third trimester, or any undetected type 2 diabetes, which may begin prior to or occur at the time of pregnancy onset. Another type, also known as type 3, is diabetes caused or associated with certain specific conditions, pathologies, and/or disorders. For example, pancreatic diabetes. Remember, insulin and glucagon are secreted in the pancreas by beta and alpha cells. Diabetes mellitus may present as increased thirst and dry mouth, frequent urination, fatigue, blurred vision, unexplained weight loss, numbness or tingling in your hands or feet, slow healing sores or cuts, frequent skin or vaginal yeast infections. If you present with 90% of these symptoms, it's time to see a medical doctor and get checked. Diabetes is usually caused by insulin resistance. Type 2 diabetes mainly results from insulin resistance. Insulin resistance happens when cells in your muscles, fat, and liver don't respond as they should to insulin. Several factors and conditions contribute to varying degrees of insulin resistance, including obesity, lack of physical activity, diet, hormonal imbalances, genetics, and certain medications. Autoimmune disease. Type 1 diabetes happens when your immune system attacks the insulin-producing cells in your pancreas. Hormonal imbalances. During pregnancy, the placenta releases hormones that cause insulin resistance. You may develop gestational diabetes if your pancreas can't produce enough insulin to overcome the insulin resistance. Pancreatic damage. Physical damage to your pancreas, from a condition, surgery, or injury, can impact its ability to make insulin, resulting in type 3 diabetes. Genetic mutations. Certain genetic mutations can cause diabetes. In our next video, we'll discuss diabetic emergencies and how to manage and prevent them. These emergencies include hypoglycemia, which is low blood sugar.
Thanks for watching BetterHealth Pharmacy. We share tips and trusted advice to help you stay healthy every day. Don't forget to like, subscribe, and hit the bell so you never miss a video. And remember, caring for your health one video at a time. See you next time.